Hello, dear listeners. Welcome to another episode of Follow Your Path. My name is Abdul Abid. I'm a surgical pathology fellow at University of Pittsburgh Medical Center, and today we will be talking to Dr. Ann Moyer. She is an associate professor of pathology and co-director of Personalized Genomic Lab at Mayo Clinic in Minnesota. Today, my co-host Meredith Herman could not join because of time constraints, but anyhow, welcome to the show, Dr. Moyer.
Thanks for having me.
Yeah, it's our pleasure. So, starting off, can you tell us about yourself, where you grew up, where you went to medical school, and how did you end up doing molecular pathology?
All right. Yeah, I grew up in Platteville, Wisconsin, and I ended up staying there for undergraduate at the University of Wisconsin Platteville. And I majored in both biology and chemistry and had a fantastic experience. And it set me up really well for coming to the Mayo Clinic for the MD PhD program. And during the MD PhD program, I ended up spending my thesis work in Dr. Winchelbaum's laboratory. He is a professor in pharmacogenomics, basically. So that's where I got my background knowledge and research side of pharmacogenomics. And then when it was time to go back to medical school, it took me a little while to figure out what exactly was going to be the best fit for me because I really kind of liked everything. And eventually, when I realized what all pathologists do, I was like, oh, that's perfect. So I think the thing that got me really excited is by the time I was done in graduate school, I knew I really liked genetics. And that was my favorite part of all of medicine. And so I explored the different opportunities and I visited with the people in clinical genomics, and their day to day work looked really interesting. But I had to admit that I kept thinking, well, where is the laboratory that's doing this genetic testing? Because that's the part that looks really exciting. And once I realized that that was within pathology, that's what drew me in. So it was a pretty easy choice to do molecular genetics within pathology because that's how I got to pathology in the first place. So after doing the pathology residency at Mayo Clinic, I did the APCP residency with a year of research. Then I ended up doing the molecular genetics fellowship and then ended up staying on staff. And one of the things that's really exciting is a lot of times what people do in graduate school and then what they actually do in their professional life are different from each other. But I'm actually now a laboratory director working in molecular genetics, and my main area of expertise is pharmacogenomics, but now on the clinical side. But I also am really interested in other hereditary genetics. So I work in renal genetics, and I'm particularly interested in complement genetics and then also immunogenetics. So end up doing a lot of different areas within genetics, mostly focused on the germline or hereditary side. And it's been a great pathway, but I'm super happy with what I do. And molecular genetics is just the perfect fit for me.
Right. Wow, that's a great story. So, along your way to becoming a molecular pathologist, were there any particular mentors that you found to be most useful, and what was their advice or any gems from them that you could share with us?
Yeah, I found a lot of mentors along the way. So some of my mentors were people not necessarily doing molecular genetics, but other areas of pathology too. And obviously, Dr. Winchelbaum, since I worked with him in graduate school, he was really helpful in thinking about career choices and how to fit research with the clinical side of things as well. But I was trying to think of what some of the most sage pieces of advice were. I think probably some of them were from some of the people that are in other areas that when you're going through that area, maybe it's not the area that is what you think you're going to do long term, but they always encouraged you to really still look at the cases carefully, learn from them what you can. And I think that was always really helpful because you never really know how two areas are going to end up tying together later. And so sometimes in molecular genetics, you end up seeing things, different types of tissue or different clinical questions than maybe you originally thought that you would be seeing. And so I think that's probably the most useful advice was just diving into every area wherever you are in medicine or within a pathology residency to get out of it what you can. I think at the end of the day, you really get out of it what you put into it. So that was probably good advice for me.
Right. Yeah, I think that's very useful advice for medical students and residents. So for molecular pathology, if you had to talk to a medical student or an incoming resident who are sort of undifferentiated, they don't know what they want to do as a specialty, and you want to convince them that they should opt for molecular pathology, among other things, what would you tell them?
I think the thing that I would actually start with is letting them know that I don't just sit in my office all by my lonesome doing my thing all day. And even in the world of Zoom, if I am sitting in my office all day, I am talking to people all the time. So, clinical pathology and especially molecular genetics, it is very much a team based specialty. And so, I think that's probably the number one thing to get across to people. And so, what I mean by that is, I work with people who are in the laboratory. So, we've got laboratory technologists who are actually doing the tests themselves. And we've got technical specialists who are the people that help with some of the more advanced troubleshooting. I get to work with genetic counselors who are laboratory based, and they help with anything from test utilization to helping with the interpretation of the reports. And I get to work with PhD scientists who are also laboratory directors, and get to work with the clinicians who are ordering these tests. And so I think it ends up being a really exciting place because it's constantly changing too. So some of the testing that we did when I started on staff and what we can do now, it's different. We can do more things. We can capture more of the genome than we used to be able to. And so I think it's something that it's an exciting area because it ties together a lot of areas of pathology. It's team based, as I mentioned, and it's always changing. So you can't really get much better than that.
Yeah. Yeah, I mean, medicine is teamwork, and pathology is an essential part of the team, and obviously, molecular pathology is part of the team. Is becoming more and more part of the team now compared to before. So that's a wonderful, wonderful introduction. So. Throughout your practice and your residency and fellowships, is there a particular case that has stayed on with you through all those years that you would like to share with us?
I did have one case that really stuck out, probably a few in general. And so I won't give you too many specifics, but during residency, I thought it was really interesting because sometimes you would go through your various rotations and you might encounter the same patient again and again. And it's something that I don't think I really expected when I was going into pathology. But one that particularly sticks with me was there was a patient who had atypical hemolytic uremic syndrome. And I first got a call about it thinking, I don't even know what this is. I was on my clinical chemistry rotation and they were going to be doing apheresis the next day. And they wanted to know what labs they needed to draw before that. And it was probably like 4:50 p.m. on a Friday. And you're like, oh, I don't know what I'm going to do about this one. So luckily, I was able to get a hold of the laboratory director who was the most specialized in that area, even though at that point in time we were sending a lot of this testing out, and she was on vacation. And she spent an hour and a half, I think, talking with me on the phone to explain exactly what we needed to collect, exactly how to handle the tubes to make sure that the specimen was had good integrity for testing, and then how we were going to go about getting it sent to where it needed to go. And then I saw that same patient later when I was on transfusion medicine and multiple other interactions along the way. So that one was one that I thought was really interesting. And that's probably a lot of why I ended up becoming really interested in complement genetics because later we were able to bring that testing in house for the genetic side. And I've got a different colleague who does the serologic testing. And so it's just been something that seeing that patient on multiple different occasions and how challenging of a diagnosis it was for that patient and their family, I think it was definitely really impactful for me.
Yeah, yeah. And for any residents who are listening, atypical HUS is also a board favorite, so you guys better study about that. So, in your day-to-day practice, what do you find is the most gratifying aspect of your job?
I think I still actually like signing out cases more than anything because a lot of the times we'll get some clinical history along with the patient. Sometimes we don't, but for the ones where we have some clinical history and then you go through your results and get the report ready for sign out, then you feel like, wow, I'm actually making a difference. But I think it's the most exciting though when somebody actually has read that report and then they call with questions and you get to find out how that test result actually was impacting the patient and what they were able to do and the follow up. I think that's by far the best. There's other aspects that are really fun too, like developing new tests or just being able to consult with others about what test to order to make sure they're getting the right one. But just anytime that you have that interface where you can find out a little bit more about the patient that was at the other end of that specimen, that's definitely the best.
Oh, wow. Yeah, I'm sure. I'm sure it is great. For molecular pathology, what does training look like? How long is usually a fellowship, and are there like boards at the end of it as well?
Yeah, so you can do either a 1 year or a 2 year fellowship coming from molecular or from pathology background. There's also cytogenetics, which is something that I think pathologists don't always think about, but that's definitely a possibility too. It would add on to your training with additional time, I think another year generally. But at any rate, then you can have a little bit broader training to be looking at really the I don't know. I sometimes think of molecular as kind of like the microscopic and cytogenetics as kind of the gross in some ways. And so you've got the opportunities to do one or both of those. But the other thing that's kind of interesting is if you do the 1 year fellowship, you can take your boards at the end of that and then go into practice. And that was the pathway that I chose because of having that background from graduate school of doing PCRs all the time and having a pretty strong molecular background. But if you were coming straight in from a pathology background and hadn't really spent much time in a lab, the 2 year pathway might be a good option because it would allow for some projects and some hands on. So then, when the first time you get that phone call from the laboratory technologist about some assay that's not working, you might have a little bit broader skill set to be able to help with that type of problem. But I think the other thing to highlight that's really neat is that in many institutions, you might be training alongside people who did not come from a pathology background. So I have colleagues who came from a PhD background and then did a clinical fellowship also. And their training pathway looks a little bit different, where theirs now is combined cytogenetics and molecular. But for all practical purposes, while they're in the molecular part, they're doing the same exact thing that you're doing as a pathologist. And so they've got a little different skill set sometimes. So sometimes they'll have a little bit more technical skills versus the average pathologist who hasn't been in a lab will have that really deep clinical knowledge. So it really makes for a nice combination being able to team up with your colleagues who have that little bit different background. And so I think that's something that's kind of exciting about molecular is that you do get to work with different people, different backgrounds, and can from there go on and be ready for your career.
Yeah, wonderful. For any residents or medical students who are thinking of maybe thinking of going into molecular later on for fellowships or specialty, what advice would you give them? What should they do now to sort of get prepared for their molecular fellowships?
Yeah, so I think probably the biggest thing is if you see some cases where maybe there's some molecular that gets added on, or you know there might be molecular testing that is going to be performed on that case, reach out to the people that are doing the testing because we like to talk to residents and sometimes they come through during their residency, their rotation. But if we get to interact with people outside of the rotation too, it ends up being really fun because you can talk through that case together and how the molecular was used. And I think that just is a good opportunity too to see it in real time and how it really will interface with perhaps anatomic pathology.
Hmm.
But in terms of whether to even do the fellowship or not, I think that's a question that I end up getting pretty frequently. So some people plan on doing, let's say, GI pathology, and they know that molecular is going to be important, but do they really need to do an entire molecular fellowship or do they not? And so I think I've been trying to encourage people that if they think that they would like to be developing tests and overseeing the lab, I would definitely do the fellowship in that case. If someone is hoping to incorporate molecular into their diagnoses and just have a really solid understanding, I think you could kind of go either way at this point. I'm hoping that over time, as molecular really gets integrated into absolutely everything in pathology, we'll end up having more and more experience during training so that you may or may not have to go on to do a fellowship to get that really in depth knowledge.
Yeah, yeah. So a supplementary question would be: are there any good resources where which residents can use to sort of like enhance their knowledge, their basic knowledge of molecular pathology?
One thing that I think is kind of neat because I think people like online tools right
Yeah.
now. There is this New England Journal of Medicine and the American Association for Clinical Chemistry have teamed up and they've got this learning lab resource. It actually has quite a bit of molecular content in it. So you might even be able to find a very basic molecular module that I might have helped create. But many of my colleagues have created more advanced modules in specific areas of molecular also. And so I think that's nice because it's a free resource that people can use. It's online. You can click through question-based learning, or there's slides that you can look at too. There are definitely textbooks that are out there too, but I feel like they're not quite as popular today, perhaps, as some of the online resources. So I'd probably start there.
Right. So I also have two small questions. One of them is you are an MD PhD, and we see many people in pathology, but a lot of medical students don't know what does it involve. Like, because I know that some people take off, like you did take. take time off during a residency for research. How does that look like for you? Like, how was that experience for you?
Yeah, so I ended up using my research year to explore a little bit more of anatomic pathology research because I knew I really liked molecular genetics. But when you're very CP oriented and you're in the average pathology residency, everybody else is really excited about anatomic pathology. So then you think, well, maybe I'm missing out on something. So I ended up spending my year working in breast cancer research as part of a really big collaborative project. So I helped review a lot of the pathology slides, and they were also growing xenografts. So it was
Mm,
breast tumors in mice. So reviewing those slides. But they also had molecular data from sequencing the tumors of these patients too. So I was able to use that data for some questions that I had. So I think it was really, for me, a good experience to see a more big picture pathology project that incorporated in different aspects that I hadn't really experienced when I was in graduate school. And so definitely I thought it was a very good experience, and I would never dissuade anybody from taking some time to do some research, because even if long term you end up practicing 100% clinical, still those research experiences give you some valuable insights and experiences that you wouldn't otherwise have had. But do you have to do a research experience? Definitely not. I think you can probably intertwine some research within what you're doing clinically, some smaller projects, and you can still definitely get really good insights by doing that. But it certainly was really fun having a research year.
right. And my second question was going to be, tell us a little about you work in pharmacogenomics. So,
Yes.
yeah.
Oh, good. So in general, what pharmacogenomics is people first are like, what are you even talking about? So for the most part, we're looking at drug metabolizing enzymes, but there's also some drug targets that we have knowledge of too. And we end up doing genetic testing to identify variants that are different from one person to another. And then based on the results of that, then it might predict that somebody would either have a higher risk of toxicity to a medication, or perhaps that the medication might not work as well for them. And so, based on the results of pharmacogenomic testing, sometimes people will want to select a different drug, or sometimes they might use a different dose. And so, at this point, though, it's predictive and it's only one variable, which I think that's really the case for a lot of laboratory testing. It's a lot of times you have to use multiple results together to figure out how to manage the patient. And pharmacogenomics is just one tool that the people prescribing medications can be using. And so I think for a lot of people, it's really new, though. It wasn't necessarily part of their medical school curriculum, or it's maybe something that they haven't encountered much before. So that's another area where either they can work with their pharmacists locally if the pharmacists have knowledge of pharmacogenomics. And if they don't, because we serve as a reference lab, we get those phone calls sometimes from clinicians outside of our institution who are interested in applying pharmacogenomics, and they need a little bit of help understanding what tests should I order, what do I do with these results. And so, diving back to your earlier question, those are the phone calls I really like to get, because with a quick interaction, sometimes you get them on their way and they can use it for more of their patients in the future once they get that really quick basic education as needed. So it ends up being a new and emerging area, I would say, of medicine, but it's definitely taking off, especially with some of the more toxic drugs where we can predict and then prevent having adverse drug reactions.
Oh wow. Yeah. I mean, that was wonderful. Thank you very much, Dr. Moyer. That's our show today, folks. You can find Dr. Moyer on Twitter, which she uses frequently. Her Twitter handle is at @AnnMoyerMD PhD. Thank you very much for listening to us. If you like the show, please like and subscribe our channels on YouTube, Apple, and Podbean. We'll be back with another episode soon.